slowly push it up.
The muscles might be stiffer these days, the knees a bit creakier, but at least they're working.
1, 2, 3, 4. Well done.
The same could not be said for much of the social care system. Not creaky knees, but on its knees.
And stop.
1.6 million people aren't getting the care they need, homes are closing, there's not enough staff, and local authorities who fund adult social care are going bust.
Punch to the middle.
And it's being felt here. Age UK and Tunbridge Wells lost £240,000 from Kent County Council, which had funded a community advice service.
We have now accumulated a waiting list, which because we're not able to spread our wings out to everybody immediately, because at the moment with the fuel crisis and just every day the rent increases, social care is all having an awful impact on a lot of people.
70% of the council's budget was spent on social care. At the same time, it's had to plug an £84 million deficit. What few people realise is that social care is generally not free. Currently, if you have more than £23,250 in savings and assets, and that includes the value of your home, you are likely to have to pay your care fees in full. Of course, many promises of reform have been made.
We are proposing the right funding model for social care.
We will fix the crisis in social care once and for all.
Today, the Conservatives have recommitted to an £86,000 lifetime cap on contributions and a multi-year funding settlement to support social care. Labour are believed to be looking at the lifetime cap, and the Lib Dems have pledged free personal care for older or disabled people at home. All of this is England only because social care is a devolved issue. We might be in Kent, but we could be in any local authority across England. They are all facing overwhelming pressure from the growing needs in social care. And whichever party gets into power after this next election, everybody in the social care sector will tell you that they have to deal with this issue because this is a system in crisis. Andy Denham, who has multiple sclerosis, has been in hospital since last September.
Social care, as we all know, there aren't enough staff in it. So to get a social care package is difficult. I mean, I need 2 carers at a time. And the last package I had was for 4 visits a day.
And what are the hospitals saying to you now?
That I've got to get out because I no longer need 24-hour nursing care.
Delayed discharges, that is people well enough to go home, have an enormous impact on the NHS. Those ambulance and A&E queues are often because there are no available beds in the hospital.
Right. So where did you go today when you went wandering off?
Can't remember now.
You can't remember? Okay.
Back in Kent, we met Ian and Jackie Humphrey. He has Alzheimer's and his wife is caring for him, but she suspects he will have to go into a home at some point. Do you understand that under the legislation as it stands now, the house will be taken into account as part of the assets?
No, I didn't know that side of it, actually. Oh, is that right?
How much do you know?
Not a lot, it would appear. Really?
Well, they can't sell it from under you.
No, apparently if he went in a home I can still stay here, but I don't know how that works. I hadn't a clue. I've never thought about that. I've never probably want to think that far ahead. It's quite, I know I should, but I find it quite frightening.
14 years ago, the economist Andrew Dilnot was asked to chair the Commission on Funding of Care and Support. He made a number of recommendations, including a care cap. Today, I sat down with him. How do you feel that it's going to be October 2025, and it was 2011 when you suggested this, that first step is going to happen 14 years later?
So I think it's very, very disappointing that it's taken us this long.
But I don't think my feelings matter very much. I think what really matters is the experience of hundreds of thousands of families and individuals who have needed care, who have been left in a completely unsatisfactory situation, and the experience of the people trying to deliver care with inadequate funds to do it, and the people trying to allocate those inadequate funds faced by decisions that would challenge the wisdom of Solomon. So we have let ourselves down. The whole nation has let itself down by not tackling this.
I mean, that is very generous of you, but we saw Theresa May saying that she was going to deal with this. We saw Boris Johnson on the doorsteps of Downing Street saying he had an oven-ready package for social care, and then it still didn't happen. So you say we've let ourselves down, but you would say the political masters have let the nation down.
It's not the area where our politicians look as though they've done best, is it? This is a challenge that faces almost all of us. 4 out of 5 of us are going to need social care before we die. We've no idea whether that will be a little or an enormous amount. The system as it is at the moment provides no way of getting any kind of security, no way of the providers being able to do as good a job as they'd like. As you can imagine, I've spoken to many politicians, Shadow Secretaries of State for Health, Secretaries of State for Health and Social Care, and one of the things that comes across in those conversations is often that they felt that while they knew in their minds that social care was critical, they thought that if they brought the social care issue up as well when they were talking with the Chancellor or the Shadow Chancellor, they'd be less likely to get the commitment to the funds they needed for healthcare. And so they chose, even though they knew it wasn't wise, wasn't the long run optimal thing, just to focus on health, because that was the thing that was highest up their agenda, had most political salience. But it is still very strange, and there's no doubt that now the struggles of the healthcare system are materially worsened by the state of the social care system. We can solve all of this as long as we face up to it, so let's hope the politicians do that.
Thank you so much for your time.
Thank you.